Hello, everyone. Hello, Dallas, and hello to all my global viewers. Thank you so much for joining and welcome. Those who are joining for the first time, the iAsia News Facebook Live and YouTube Live program today, and this is your host Anu from Global Gupshup. Uh, as you all know, who are joining the first time, Asia News is a very well-known broadcasting media here, serving the community with quality programs throughout the week, Monday through Sunday, and presenting many live programs, different countries, and also throughout the USA as well. And you can enjoy variety programs like a morning yoga, meditation, like a religious discourse, social, economical, political, and entertainment news, especially the music concerts and stuff. And especially my live talk show with the variety of subjects that you can enjoy on Global Gupshup every week. So before we start, we all heard that this week has been a very tough week because it's a difficult situation. That's a flood and a heavy rain that's happening in Hyderabad, India. So let us send a lot of prayers towards them for the safety of people who are affected by it. It must be very hard for them to get recovery from that. So it's been more than 6 months, I would say maybe 8 months, come to think of it. The world has been really struggling to survive the deadly pandemic of COVID 19, and even a small ray of hope. It's coming on the way that can bring a smile and comfort in people throughout the global countries that that are suffering severely affected by this virus. So the reason I'm saying is because our today's guest has a very promising different view, different approach to this problem. And he strongly believe that the power of cure is within us, meaning that we just have to give ourselves enough time to our body to make that attempt to fight it instead of just, rushing back and just, go and treat it with unnecessary, the chemical hormone anything that what you can call. So our today's guest is a doctor of homeopathy, and he has his BHMS, homeopathic medicine, as well as a surgery. And since from 1990, he has been practicing successfully, and he's none other than Dr. Manoj um, Kuriakose, and he's from Hyderabad. And it's a pleasure to welcome him to the show, Global Gupshup. Thank you, Dr. Manoj. It's a pleasure having you. And it's definitely, we are excited to see you and also hear a different view that what you actually talked about during our conversation. Thank you so much for joining. Pleasure having you.
Hello, Anu. Good morning. Sorry, I lost the entire conversation. I just had my Wi-Fi back. There has been a lot of rains here. I'm back on live.
No
I didn't
problem.
hear anything about you said. I'm really sorry about that.
No worries. I just introduced you to our audience, and it's a pleasure having you on my show, Global Gupshup. Yes, we totally understand because of the rain that we do have a lot of interruption. It's completely understandable. So we would love to have on our show. And so before even we go further, so I'm going to ask you just, like tell us a little bit about yourself, and we'll start from that. How about that?
So I have been practicing at
Hmm.
in Hyderabad for the last 30 years, and I don't want to talk much about myself. There are a lot of people waiting to listen to us talk about a different perspective about COVID and
Hmm.
information about COVID. I think we will dive right into that. And all my information is available on drmanoj.com. So let's straight get into the talk.
Absolutely, absolutely. Like he said, you can visit his website for more information about knowing about it. Dr. Manoj, let's start like when we were talking a little bit about. So, you have a very interesting view about the word disease. So, how about let's start with that? Let's talk about like what do you say the disease is completely different than how we view it, and also the several terms that comes with it. So, give us your definition of disease.
See, the word disease itself says dis-ease. That means you're not at ease.
Mhm.
Anything that can make you not at ease is called as a disease. Okay. But then unfortunately for us, disease is a very negative term. We look at, diseases like cancer, blood pressure, diabetes, everything is looked upon as something very horrible.
Mhm.
It's not that. Disease is nothing but the body is conveying to you that there is some kind of disease. I'm not at ease.
Mhm.
It's the body's way of telling you that there is something that is not right with me. You take care of it. Either you take care of it by changing your lifestyle, or you
Mhm.
take care of it by going to a doctor and then rectifying it.
Right,
So the
right.
disease is not a negative term. Disease is a good thing. The body is just telling you that there's something not right. You take care of it.
Okay. So when you're saying the disease, some of the diseases does not even have a symptoms until it is too late. So what is your take on it?
So Anu, let me ask you this thing. How many cases do you know that
Mhm.
there has been a problem, but they have not been diagnosed? They got diagnosed very late in the stage. That
Correct,
means they don't know
correct.
anything is wrong, but
Mhm.
suddenly they get to know that there's something wrong with them. How many cases do you know?
Very few. I mean, like I would say maybe 5%,
All
possibly.
right. All right.
Hmm.
So instead of focusing on the 95% which is positive, it's human tendency to focus on that 5% which is negative.
Ah, okay.
We give so much of importance to that 5%. Suddenly if something happens to me, then what? But the
Mhm.
fact is 95% of the time nothing can happen.
Right, right.
But our psyche, our fear is so much that we focus on that 5%. And we live our entire life, oh, something shouldn't happen to me suddenly. But
Hmm.
then we need to, if you look at it spiritually, eventually if
Hmm.
something is meant to happen, it'll anyway happen.
Right, 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 right. So today, actually, we did, our topic is like we talk about the current situation, what all we are going through. It is like I said, the COVID is not exactly how everybody sees this as it's a curse. It's actually a compliment, is what you're saying. So, how is this different than any other virus that what you are actually seeing it? Like, why did you say that, it is not a curse, look at it in a different way. So elaborate and then give us your view on it, that we are curious to know.
All right. So see, since the time COVID started, I have been giving a few talks and all that. Now
Mm-hmm.
people come to listen to a perspective about COVID. They come to think, they want to hear about what is COVID, how does the COVID spread, what does it do inside your body, is COVID man-made, is it a natural thing? These are the things that people come to listen to. But I'm not going to talk about all that. I mean,
Mm-hmm.
a class 2 student now knows that what is
Mm-hmm.
supposed to do to prevent COVID, hand washing and all this. So let's not waste time talking about it. Okay, my perspective has always been different about COVID. Now, since the time COVID started, I've always been telling people that more than the COVID, it is the fear that is associated with COVID that is
Mm-hmm.
dangerous. It is not the
Right.
COVID. COVID is nothing but a virus. All right.
Mm-hmm.
Now, we've gone through COVID, we have gone through lockdown, we have gone through restricted life, we have worked from home. There has been so many changes that has happened. Now, let me give you an example. In Hyderabad, the Merchants Association, the Shopkeepers Association, they have decided that they're going to close their shops at 5 in the evening. They have
Mm-hmm.
decided that they're going to keep, Saturdays and Sundays off.
Mm-hmm.
Now, this, according to me, is a major change in the mindset of
Of
people.
course. Yes.
Now, people have started spending a lot of time at home. They've started spending time with the family. They suddenly they have a lot of time in hand.
Yes.
Now, there was so much of a rush in a day to day life that
Mm-hmm.
there was no pause. Now, suddenly, the
Mm-hmm.
virus made everybody pause. The life came to a standstill for everybody. Now, the reason the people could give a pause, they could always give a pause before also. But now, the reason they're giving a pause is because
Mm-hmm.
their competitor is also in pause mode. We are all
Correct.
running against the competition. You
Correct.
take it as a doctor, a lawyer, a businessman. Okay.
Mm-hmm.
The reason you don't take a break is because you don't want your competitor to overtake you.
Correct.
But now the entire world was in pause, let's say. Unfortunately, now the pause button has been removed and we are kind of getting back to normalcy. But
Mm-hmm.
what God and God man couldn't do, COVID could do. Now,
Mm.
have you ever seen such a vast shift in the mindset of people? Ever?
No, it's very shocking, actually. Yes, you're absolutely
Yeah.
right. So,
So many. So the perspectives have changed like crazy. God
okay.
tried to do that. God men tried to do that. But no, it didn't happen.
Mm-hmm.
But COVID
Mm-hmm.
could do a lot of things. Now, the biggest example that I can take is,
Mm-hmm.
the best thing that happened is COVID has affected people of all caste,
Mm-hmm.
all religion, all
Right.
financial, this thing. It is not spared anybody, including Trump.
Yes, you're
So,
right.
that is the reason there has been a global shift because it's not.
Wow.
Now, people have suddenly realized that God and religion also couldn't do anything. I mean, if
Mm-hmm.
that was the case, I'm sure, the Christians wouldn't have got it, or the Hindus wouldn't have got it, or the Muslims wouldn't have got it. No. Where is God now? Where is God man now? What happened to all those God men who were out? They are all hiding.
Mm-hmm.
I mean, there were a lot of people who were coming and hugging people, kissing people. They all disappeared the moment COVID came.
Right. Right.
So, there has been so much of a shift. Now, people have started eating inside.
Mm-hmm.
They've been eating home food.
Correct.
How many times, let me ask you as a person, in the last 8 months, how many times have you gone to a doctor?
Not many
No.
times
See,
at all.
on a normal lifestyle, people would go to the doctor at least once a month or twice a month, either with a tummy upset or with a flu or some sort of symptoms. But in the last 8 months, everybody is fine. There are two reasons. Number one, they are not falling sick.
Mm-hmm.
Number two, they're scared to go to the hospital
Mm-hmm.
because they don't want to catch COVID. So in the process, what they are doing is, suppose you get a cold, you're staying at home. Let's see, couple of days. If I don't get better, I will go.
Mm-hmm.
So the body is treating itself. In a couple of days, you get better. You don't feel the need to go to a doctor.
Right.
But pre-COVID, the moment you get a cold or a cough, I want to treat it. I don't want to lose one day in my office. So the moment you get some sickness, you go to the doctor, you gulp a lot of medication, you get better, but you are not even giving your body a chance to heal itself.
Mm-hmm.
You
Mm-hmm.
know, the 70
Yes.
the 70% of the population who live in the rural areas and the people
Mm-hmm.
who can't afford medical treatment, this is what they do. They
Mm-hmm.
fall sick, they hang on for a couple of days, they become all right.
Mm-hmm.
Now,
So,
I
so
yeah,
I'm sorry to interrupt, but
good.
so you're saying that so they are automatically learning to take a better care of themselves because they even this fear itself is also serving in a kind of a positive way. Is that what you're saying, basically?
Absolutely.
Okay.
Last 8 months, let me ask you, where has emergency medicine gone?
Mm-hmm.
Now, the hospitals were 80% empty.
Mm-hmm.
No surgeries were happening in the last 8 months. Investigations. Let's talk about an ultrasound in a diagnostic center. If they would do 250 ultrasound a day, they
Mm-hmm.
were doing about 2 to 3 ultrasound a day. If
Okay.
they were doing 50 surgeries a day, they were either having no surgeries or one or two surgeries. 50 CT scans, they were having no CT scans or one CT scans in the last 8 months. I'm not talking about a week, 10 days time. I'm talking about the consumption of medicine has dropped by 35%.
Mm-hmm.
There are no heart attacks reported. People are not dying because of heart attack. People are all dying only because of COVID and the fear of COVID. Now, how is it possible that the emergency has suddenly gone out of the window?
Okay. So,
Which means we are all living wrong. Yes, it is the fear of COVID that has stopped people from going to the hospital, which is a good thing.
mm-hmm.
They're letting their body heal themselves.
Mm-hmm.
It is not that things have changed vastly. The only thing that would have changed is they would have probably stopped eating outside because the hotels were closed.
Mm-hmm.
I don't attribute that as the only reason for their being healthy. I believe that, I mean, they are less stressed. I strongly believe it is the competition that was making everybody stressful. You're
So
always competing against somebody. Yeah,
somebody. No, I was actually referring to the COVID. So let's take that COVID example. So even if we take like a 2, 3 days, like we always wait until it comes. So let's apply the same rule for this COVID. So we are waiting until the symptoms show up. And so, do you also believe? Because I know that you confidently said that that's 80% of like my patients who came to get treatment from me with the COVID. have recovered, and also like, and I can say with the confidence that it is possible that with some kind of a different way of a treatment. So what is that you're doing something different from all other medications that in your treatment? So any specific like something that what we are not catching with the other one? Because fear is absolutely, I agree with you, yes, that is spread because everyone is so like following the rules, but when it comes to that point, then yes, they get fear and they have to go to the hospital, and that is how we normally follow. But so what is that your medication that that is doing something different, that 80% of the patients are coming out as a cured this so-called COVID?
All right. It's more than the medicines that I'm giving. It is my approach which is successful. So I'll take a little time and I'll explain to you what it is. See,
Sure.
since the COVID started, whether it is the WHO or whether it is the media, everybody have been talking that people who are aged and people with underlying conditions are at the risk of dying because of COVID. All right.
Mm-hmm.
This is the
Mm-hmm.
so now people when they started to hear that there was a fear which is developed in a lot of people. Even you look at even today, most of the people who are either aged or people who have got underlying conditions are scared. All
Right.
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 Now, but if you look at the statistics starting from day one to today,
Mm-hmm.
let's talk about India.
Okay.
We've lost about, in the last 6 months, we've lost about 1 lakh people because of COVID. 1 lakh people.
Okay.
So we are staying at 1% death rate. That means out of 100 people, only 1% of the first people are dying. All
Okay.
right.
Mm-hmm.
Now, if it is true that everybody who's got diabetes, everybody who's got BP will die of COVID, it couldn't have been 1 lakh. It would have been 100 lakh people who would have died.
Okay.
All right. So that means that statement itself is wrong. Only only 98, only 1% is dying. Now, if you look at heart attack, for instance, in an year, you lose
Mm-hmm.
about 25 lakh people. You compare a heart attack, 25
Mm-hmm.
lakh people to 1 lakh people in 6 months' time. The death rate in COVID is very, very low.
Okay.
Now, last year, also, you would have gone through the same symptoms of a virus. You would have got a cold, you would have got a cough, you would have got body pains. What would you do about it? Either you don't take medicines or you take off the counter medicines and you would be fine.
Mm-hmm.
But
Right.
now, the moment you get a cold and cough, the first thing you do is you suspect COVID, you go and get yourself tested. The moment you get yourself tested, there are two things that can happen. One is either you become negative or you're positive. If you're negative, you're fine for the next couple of days' time. Then somebody starts coughing around you, or you start coughing, you want to get it tested once again. Yes or
Mm-hmm.
no?
Yes,
Now, the
absolutely.
fact is that only 65% of the test is accurate, 35% is false negative.
Mm-hmm.
So you don't know if you're false negative also. All right. So that's a never ending fear. You keep testing, testing. I know people who test every 3 days, 4 days for COVID.
Mm-hmm.
If you're positive, what do you do?
Mm-hmm.
Now, once you're
Mm-hmm.
positive, then the panic button. Okay, I'm
Mm-hmm.
COVID positive. Something is going to happen. And if that person happens to be aged person, or if he's got underlying condition, then he starts to panic.
Right.
Now, when you panic, what happens when you panic is you tend to take shallow breath.
Short of breath.
That's a
Mm-hmm.
panic, short of breath.
Right.
When
Mm-hmm.
you do that, carbon dioxide accumulates in the lungs and you start feeling breathless. So you call up the doctor, doctor, I'm COVID positive, I'm feeling breathless. And then the doctor says, come. But your lungs are not affected. COVID is not what is causing your breathlessness. Your breathlessness is clearly happening because of excessive carbon dioxide because you're panicking.
Okay.
Now you go to the hospital, the doctor doesn't care what is causing breathlessness. He puts you in an isolation ward. You go into an isolation ward, you're surrounded by people with COVID. You cannot meet anybody from your family. Adds on more to the panic. And if you're
Mm-hmm.
aged, I've had people calling me from the hospital saying, Doctor, I'm in the hospital. I don't think I'll come home.
Mm-hmm.
Because for the old people and people with underlying condition, it's there in their mind that if they get COVID and if they're hospitalized, they won't come back.
Okay.
I know many people who have had no symptoms, they were hospitalized, zero symptoms. They were hospitalized and they died
Mm-hmm.
purely because
Mm-hmm.
of fear. A
Mm-hmm.
small example of one lady who's just 35 years old.
Mm-hmm.
She was an asthmatic. Okay, so she started feeling breathless. The husband took her to one hospital. The hospital people said, looks like COVID symptoms. We can't give you admission here. Go to another hospital. She went to hospital number two. Mind you, she was not even checked for COVID. Hospital number two, they said, you have breathlessness, maybe COVID. Gave her oxygen. Said, there's no place here. Go to the third hospital. Third, fourth, fifth. By the time she reached the fifth hospital, she died. The
Mm-hmm.
newspaper says she died of COVID, but she was not even tested for COVID.
Mm-hmm.
Now imagine you were that lady in the stretcher going from hospital number one, two,
Mm-hmm.
three, four, five. Just imagine what your state of mind is.
Mm-hmm.
The more you
Correct.
panic, the more carbon dioxide, and you die only because of cooling of carbon dioxide, not because of COVID. There are many people who are dying like that.
Mm-hmm.
Now, what I'm trying to say is, trying to tell people is when they have symptoms of COVID, what I do with my patients is I'm telling them, don't get it tested. Okay.
Okay.
You treat yourself. What would you know normally? Okay. Let me ask you one thing. Now, so many years you have survived. Let's say I'm 50, 50 years of my life, 52 years of my life. My body has always told me that what is wrong with me. That is
Right.
called as a disease. It tells me if I get a cough, if there is something that is going wrong in the body has the capacity to tell you, it has got the ability to tell you, I got some problem, take care of me. Do you believe in that? Have you survived
Mm-hmm.
all these years like that or no?
Yes. Yes.
Now,
Common cold,
sudden
fever. Yes.
anything, the body will tell
Right.
you.
Mm-hmm.
I mean, okay, in 1% of the cases, sometimes it happens that suddenly you die. Okay, that's let's not look at that 1%.
Right.
Suddenly, since the COVID has come, people started to think that the body does not have the ability to tell you what is wrong. People stop believing that all these years they survived because the body can tell you what is wrong.
Mm-hmm.
Now, the moment you are suspected of COVID, you call up the doctor. What are you doing? Before I come to that, WHO and every scientific community says that immunity is the thing that will take care of your COVID. Correct?
Right.
Now, the moment you are diagnosed with COVID, you call up the doctor, you panic. The doctor also, he doesn't want to take a chance. He'll put you on an antibiotic, he'll put you on an antiviral, HCQ, steroid, and whatnot. The CARDA, vitamin, zinc, everything. Now, your body is taking care of itself. You have no symptoms. That means your immunity is very good. You panic and you gulp all these medications. What are you doing by it? You're destroying your immunity, which is actually taking care of it.
Mm-hmm.
The moment you consume so much of medications, your immunity is destroyed. The COVID takes an upper hand. That is how the COVID spreads into your body and goes into your lungs and causes infection. So my funda to my patients are very clear. Treat your symptoms. Listen to your body. First stage, asymptomatic. Don't treat. Take homeopathic medicines. Take Ayurvedic medicines. Take home remedies. Stage number two, you get symptoms of cold, cough, fever. Take paracetamol. Take something for the cold. No problem. Stage number three, you start feeling breathless. Now, when you get breathless, you decide whether it is you are panicking and breathless or it is breathlessness because of the lung. I'll tell you the difference. When you panic and have breathlessness, you tend to take deep breath. I'm not getting enough breath. I'm not getting enough breath. You panic. But if it is because of the lungs, you tend to get sounds.
Mm-hmm.
Okay?
Okay.
You get breathless. You cough. You have
Mm-hmm.
fever. You feel sick. That's when you get in touch with the doctor. Then the doctor will decide whether you need to get admitted in the hospital or whether you need some therapy or anything. There are people what they do the moment they get COVID, they put oximeter.
Mm-hmm.
Have you ever heard of oximeter in your life? I'll ask you
No.
this. 30
No.
years of my practice, 30 years of my practice, till today, I have not seen an oximeter. I'm
Yes.
not kidding.
Yes. You're right.
Every Tom, Dick, and Harry now is manufacturing oximeter. God knows what kind of quality control is there. Now I get call saying, "Doctor, my child's oximeter levels are showing low. What is wrong with your child? Nothing, but oximeter is showing low." I tell you, the oximeter will show because our body's oxygen levels keep fluctuating depending upon our activities, physical activities, or emotional state. It'll keep fluctuating, but we never bothered to check it in the past.
Correct. Right. Right. Right.
So suddenly you are monitoring. Now, oximeter has become like one lifeline for everybody. Everything depends upon oximeter. It's going crazy. I mean, people are going crazy.
Right.
You shouldn't be looking at the oximeter. Why can't you listen to your body and then act accordingly? Why listen to oximeter? Why do all this kind of nonsense and get yourself into trouble? Now, let me correct you this. It's not 80%, Anu. I've got 96% of the people who have improved.
Wow.
Statistics.
That's even much better.
96%. Yeah,
Wow.
96% of the people.
People.
We've been given preventive to people also, and
Mm-hmm.
we've had very, very good success rate with preventive and immunity. We are giving medicines to build immunity. Look, it's just a virus. There's nothing to be scared of it. I appreciate Trump for what he has done. He may
Mm-hmm.
be eccentric, he may be doing whatever it is, but what he has done, whether going to the hospital, getting himself admitted, getting out in 4 days' time, and saying that, look, it's just a virus. He spread a lot of courage to people. I think that's what national leaders should be doing. I'm not talking about his other aspects of whatever he's doing, but this is something that I truly appreciate what he has done, because just imagine a lot of people following him, that fear would have disappeared from their life.
Mm-hmm.
That's exactly the need of the hour today.
So what like we just talked about homeopathic medicine. So normally the belief, I don't know whether it's true, so I'm going to ask you that question. The homeopathic medicine, it should be working, it takes its own time, meaning it's the slow process. So is that true? So if that is the case, then like if COVID is one of the that the disease that you're treating with the homeopathy, so how long does it take, like, or I mean, I'm just curious about like how does it work?
Yeah. So the fact number one is that it is not true that homeopathy works slow. The reason that
Okay.
statement has come is because homeopathy normally gets chronic cases. Now, what I mean by chronic cases is people who have been suffering, let's say, since a skin problem for the last 5 years,
Okay.
asthma for the last 20 years,
Mm-hmm.
epilepsy for the last 15 years, diabetic for the last 20 years. Now, people who come to us with problems which have been there for the last 10 or 20 years time, you don't expect it to go even in a day or two, right?
Mm-hmm. Right, right.
So we've always dealt with people problems which have been chronic, which have been there for the last so many years. That
Mm-hmm.
is why homeopathy takes a little time. But when it comes
Mm-hmm.
to acute cases, look, 30 years of my practice,
Mm-hmm.
hundreds of people who come to me every day. People come with cold, cough, fever. They get better in a day or two. Lose motion, they get better in a day or two. These are acute problems. Now,
Okay.
virus is an acute problem. All my life, we have treated all those families who come to us, their children. Very, very rarely they go on an antibiotic or an antiviral. Whenever they have an acute cold, cough, fever, loose motion, they call me up. We give medicines. Within a day or two, they become all right. It's totally wrong that homeopathy can do wonders. It can stop
Oh,
cold within a few hours if the correct medicine is given.
okay.
So
Okay.
that's a
So
myth. That's not true.
okay. Well, thanks for clarifying that one, because I know that I heard it from several, sources that, that it will take its, I mean, it is definitely effective, but it takes its own sweet time for the cure. It might be a little slow process. So, moving on to the next one, I just wanted to ask you, I know that in allopathic medicine and all that, like a lot of, see, because of the vaccine that, they are doing a lot of clinical trials. So is it happening in homeopathy as well? And I believe I heard that, you're also invited to one of those. So can you just enlighten a little bit about that as well?
I'll do that. But before that, let me clarify one thing.
Uh-huh.
This vaccines which we are waiting so eagerly with. Now,
Right.
once his vaccines are approved, normally a vaccine takes about 5 years time for approval.
Okay.
Now, with the kind of speedy approval that is being, done by the government and all that, even if the vaccine comes,
Hmm.
according to statistics, it will reach only 7% of the population.
Okay.
7%, mind you this. For
Okay.
it to reach more people, it's going to take 2022. It's going to take a couple of years.
Sure.
There is no. It's just people are racing against time and hope that vaccine will come up.
Hmm.
So what has happened in India is, a lot of alternative systems of people have claimed to have cure for COVID. So the
Hmm.
government, Ayush government, has invited proposals for clinical trials from all those people, and
Hmm.
I've been one of them who have been fortunate to be invited by the Ayush Ministry.
Hmm.
We are in the process of in the final stages of the approval for conducting trials. So in that regard, in the last 6 months' time, we have done a lot of work about COVID, and then yes, it is almost in the final stages of approval. There are a lot of bureaucratic hassles and all that which comes for these things, but we have been crossing them one after the other. We are in the doorsteps of doing clinical trials, and yes, it should happen in the next 1 month or so.
Okay. So that is it's not just about the vaccine. So any other, like, you in some of your information videos that you also talked about, like a cancer or any kind of other diseases, and also, so those also have gone through the clinical trials before you came up with the medication, or they like how does the process work with the homeopathy? Is this the same as the other ones?
Unfortunately, in the Ayush system, Ayush is Ayurveda, Unani Yoga, Siddha,
Hmm.
homeopathy.
Okay.
Unfortunately, there have not been many clinical trials that have happened in the alternative systems of medicine. So
Okay.
what we are trying to do now, because of COVID, is one of the first official and world acceptable standards of clinical trials that we are starting on.
Okay.
But what we do have is a lot of testimony, a lot of literature, a lot of statistics that
Hmm.
proves how homeopathy can help in a way, a lot of diseases like cancer, diabetes, blood pressure, asthma. We do have statistics, but clinical research, not much.
Okay. Okay. So, well, that is okay. So you just mentioned that, it may take until 2022 to reach the complete, the effectiveness of the vaccine. So what is your take on, like, how do you, I mean, where are we now, or how do we end up with, like, where is it going? When does it end? How does it, this COVID?
See, all due respect to World Health Organization and a lot of other scientific community, right from the time it started, they've given us a few rules like washing hands, maintaining social distances, wearing masks. Well, a lot of us have been practicing it, but
Mhm.
do you see a decline in cases happening or an increase in cases that is happening?
It depends on the areas, because statistics, I'm not even though sure. We still are, I mean, just as in entirely speaking, we still don't have a control over it, is what my view. I mean,
Absolutely, I agree. So,
mhm,
according to me, if these things were helping, cases should have
mhm.
come down. At least a few countries should have been corona COVID free right now.
Okay.
Obviously, that is not helping the way it is supposed to be. Now, you will say that no, people are not following the rules that is laid down. But I would say, do you even see a possibility of everybody coming together and following these rules? It's
Mhm.
not going to happen.
Going to, right, right.
Now, let me ask you a very simple question. Somebody like
Mhm.
Trump,
Okay.
the most protected person in the world, if he can get COVID, how are you and I going to be protected from COVID? How long will you and I hide from COVID? So what I'm trying to say, Anu, is that this COVID infection is a
Mhm.
virus, and according to me, it is going to catch everybody. All
Mhm.
right?
Mhm.
People whose immune system is good, they will get a COVID, they will not even know about it. Now, I had a patient who went to Mumbai for a meeting. He came back.
Mhm.
He suddenly realized that one of the colleagues in the Mumbai meeting had COVID. So a
Right.
couple of days he got a test done. He was positive, but he had zero symptoms.
Mhm.
Now there are millions of us who are COVID positive but zero symptoms. That means their immune system is very good. They get
Mhm.
COVID, it goes away. Now, according to me, all of us will get COVID
Mhm.
and we will get out of it. This is called as herd immunity. Then you develop
Right.
antibodies
Right.
and then we live with it. It's like a common cold. It'll come, go, it'll come, go. The fear will go away. As it is, don't you see the fear going away? There are a lot of parties happening, movie theaters are starting, cases are increasing, mind you. We're going to overtake, India is going to overtake US shortly. But we have started partying, the fear is gone out. So we
Right.
learn to live with it. That's all. It'll become a part of our life. That's all. The older
So
people, yeah, go ahead.
no, no. So you are saying that, see, our like someday that you believe that human body will develop an immunity to this kind of a virus, and then, so I mean, let's assume that, this vaccine does not work, or something goes wrong. So you think that our body will develop automatically the immune system, and then, some kind of a, solution will be automatically done by our immune system. Is that what you also suggest?
I know not going to develop, we have already developed.
Okay.
There are so many of us who have got COVID and come out of it successfully. There are so many people who have had no problems.
Okay.
99% of the people are coming out of COVID like a common cold. Except if you remove the fear factor from it, they get COVID, they get cold and cough, they take some medicine, they are fine. And they are called as COVID barriers. Then they don't get it again. Now, recurrent infections are very, very few that has been recorded in the world. Very, very few recurrent second infections. Very few recurrent. Let's
Mhm.
forget that small percentage of people who are getting reinfected. But otherwise, what is wrong in thinking that once you get COVID, you won't get it again and live free? I
Okay.
mean, I would say yes, we are already developing immunity and we
Developing.
are all doing good. So it's time to
Just
live life.
accept it and then live a normal life and lead something that's okay. So since we have a few more minutes, that let me take one of the questions from our viewers. So, what is the homeopathic treatment you are referring to for COVID-19? This is asked by Mr. Chris Chakravarti.
So it depends from person to person. See, homeopathy is basically symptom based. Now, if you've got symptoms of a cold, cough, body pains, it is different. If you've got loss of smell, the drugs can be different. If
Mhm.
you've got breathlessness, it can be different. Now, this is how homeopathy is practiced worldwide. So you need to consult your local doctor who will be able to help you. Be in touch with him. You don't have to go to him. You can talk to any one of the doctor on the phone. Tell him what are your symptoms, and he'll be able to tell you what medicine to take.
Right.
But what I am doing is I am trying to make a combination and see where specific drugs can be given to all COVID patients. That is how I have been doing, because I
Mhm.
want to get into the clinical trials with that same specific so that it can be widely used in a larger number of population. But
Nice.
traditionally, call up your doctor, tell him your symptoms. It's a very easy way. He'll be able to help you out.
So yeah, I mean specifically he was probably asking like, the what is the homeopathic treatment like as a medicinal probably
Yeah,
that like
according to Ayush guidelines, the preventive that is being given is arsenic 30. Arsenic 30 once in a month is what the Ayush government has given. But I
Mhm.
would say arsenic 30 to be taken every week because there's so much of cases, So you take arsenic
Mhm.
30 once in a week. Now, if you are tested positive, then you will have to consult a doctor and be in touch with the doctor, according to the symptoms and all that. But broadly, if you want to know what I treat, arsenic, phosphorus, bryonia, these are three, four
All the
medicines which, hepar sulf, carboveg, depending upon the intensity of the case, these are few of the medicines which have been very successful.
wow. Well, thank you so much for introducing us something a different view about COVID because I think, like I said, a small ray of hope will be definitely bringing a smile on everybody's face at this point because we are definitely getting tired of hearing even that word COVID anymore. So, like you said, hopefully we'll get back to normal. And so, just what is your the message to our viewers that to stay strong and just stay calm and stay safe with the any of your instructions, please.
You know what? COVID has taught us a lot of lessons. When you go
Hmm.
back to the normal, don't forget the
Hmm.
lessons that COVID has taught you.
Right.
Let's stick to those lessons which has kept us healthy for the last 7 to 8 months. We have had a
Hmm.
wonderful life in the last 7 to 8 months. It has been beautiful for most of the people.
Right.
Now, I am also recommending people, particularly the people who are aged and all that, if you're living in the city, if you've got a
Hmm.
farmhouse somewhere, shift to the farmhouse. I
Shift to
call
the
it as village. I call it as village wapsi. Now,
hmm.
I'm calling out to people in the NRIs who are staying abroad. People who are working
Right.
in the US and all that. You're anyway working from home. I say, give your company an offer. Let me work from my village. You pay me half the salary. You go back to your village. You know what will happen in that once you go back to your village? You work for 8 hours or 9 hours. The rest of the day, you have a lot of time in developing the entire village. You have the intelligence to help people around you. Now, if the village develops around you, then the districts, there is an overall development that will happen in our country. Now, my thing is, I've been staying in a farmhouse and working, and
Hmm.
I can't tell you the joy of living there. It is so beautiful. I think all of you should experience it. If you have a chance to go and stay you can stay without a mask in the farmhouse, in the village. You don't have to wear a damn mask and then, suffocate yourself. This freedom of walking around in the green fields, getting wet in the rain, it's so much beauty out there. My suggestion, get out of the city, lead a good, clean, beautiful life.
Clean air, clean water, and then give yourself something to relax and
Ab-
just be with your family and stay safe. Well,
Absolutely.
thank you so much, Dr. Manoj. This was a wonderful conversation and also advice and thank you for sharing your wisdom and expertise on something different that what we can actually learn from you. So hopefully our audience learned a lot and definitely start, adopting some of those advice that you just gave. And we will definitely keep you updated if you have any of the questions. And please do visit his website, drmanoj.com. and he has a lot of tips as well as the videos that you can actually watch and get answers for your questions. And thank you so much for joining. And it is really a pleasure having you all with us here on Global Gupshup. And stay tuned also. Tomorrow, we're going to also have another very interesting topic that we are going to be coming up with. And the very well-known ISRO scientist, Dr. Anadura, is going to be on the show, and really looking forward to have you on it. And have a wonderful night, wonderful evening, and wonderful morning, everyone. Thank you so much.
Thank you.